can you tell me about the challenges that Oliver has faced in the last 6 months through the coronavirus and any existing issues that have been exacerbated by this pandemic?
I think when it first hit, our immediate thought, the entire leadership team, really everyone in the company, was keeping our employees safe first and foremost, right? It really started with that. We weren't even going to think about any other issue until we could think about the safety of our team. And being part of that supply chain, we recognize we're also critical. So the idea of just kind of closing up shop isn't an option, because the industry depends on us for packaging, for keeping things safe. So the immediate focus and the hardest challenge was, we got to get this right. We got to keep our people safe. And I think we've had a pretty good track record at that. So I tip my cap to our safety team and operations team, who went all out to keep our manufacturing sites safe, and also to our administrative employees, who suddenly, within a day, were working from home for the next 6 months and didn't know it. So now you're struggling to build a home office, stay productive, stay responsive to customer needs, while juggling at-home schooling, right? And I have 3 young ones in school, right? So it's just, I think of all the challenges, on the personal side, met the professional side this year, and I'm just really proud of the team at Oliver for how we've attacked that and overcome that and continue to produce. So moving past that and then into the industry challenges. The thing we probably didn't anticipate is, at least in the Americas, and other regions felt this too, is elective surgeries, right? So as elective surgeries stopped really in March.
Completely, other than emergencies, right? I mean, completely.
So trauma still was there, right? Life-threatening, but anything considered elective that could be put off for a little bit longer was, and hospitals just really stopped their consumption of devices and supplies if it wasn't related to COVID. And that impacts everybody, right? So we know that impacts our customers, who suddenly stop production themselves. They stop ordering packaging. That has effects on us. So, we went through a bit of a slowdown there as we try to react to all these electives. Now, as those are turning back on, hospitals are starting to do electives again. They're starting to catch up. They're not back to 100%, but it becomes almost like a forecasting in demand. If you think of a spigot being abruptly shut off, slowly turned back on, what we're trying to watch for is, if there's a rush and suddenly elective surgeries open right back up, that spigot gets opened up full, we've got to stay responsive to that. So
I think it's likely to happen, Steve, because we're learning how to manage prevention of coronavirus, and that will allow us to do a lot more normal life activities, including elective surgeries, right?
Absolutely. All right. So we're anticipating, we're doing our best to, stock up where we can, or work with customers who have some line of sight to their demand, and just, it's about staying nimble. This is where we're going to learn a lot from our new acquisition. They're incredibly nimble, right? And they can produce, really with days notice. And we're going to learn a lot from them to become more nimbler on our side, because the industry demands it. We recognize nobody wants to be put in a bind. Nobody wants to give their supplier short notice. You're doing it because you have no other choice. And in those situations, we've got to rise to the occasion. We're confident we can do that.